Hey you guys, I'm Dr. Sharma, and I think the study of psychiatry and psychology is intriguing. But I think there are some common misconceptions about some psychiatric illnesses and diseases that are used out of context and sort of in the realm of calling people crazy or out of their mind. I think that connotation should seriously be debunked and avoided as much as possible. Because no matter what sort of mental illness or issue some person is going through, every person still has a name, and every person is unique, and they got there for a reason. So therefore, don't be disrespectful. That being said, there are many personality traits or combination thereof that may be presented as personality disorders, according to the Diagnostic and Statistical Manual that psychologists and psychiatrists use to diagnose and categorize certain psychiatric illnesses. These personality disorders are characterized into clusters. Cluster A includes some of the more eccentric or odd types of the personality disorders. These individuals may find it difficult to develop meaningful and social relationships. There's cluster B, which is a little bit more of the dramatic and emotional type of personality disorders. There is actually a strong association with substance abuse and other psychiatric disorders such as anxiety and depression. And then there's cluster C disorders, which are more of the worrisome disorders, including avoidant obsessive compulsive personality disorder and dependent personality disorder. These also exhibit an association with anxiety. I want to talk about narcissistic personality disorder and how you can start to sort of pin out traits and characteristics of this particular disorder, which is actually pretty common in our population, and it's part of the cluster B group. First and foremost, it's as the name suggests. These individuals tend to have a sense of entitlement. They have a strong tendency to think that they are right a large percentage of the time, to the point that it almost feels to other individuals to be sort of excessive. Of course, our population will have varying degrees of people who have strong opinions, and those who will try to put them forward, because there are people who are just professionals at one certain topic, people who just have strong opinions in terms of political views and religion, etc. But it's almost impossible for some individuals to accept other people's opinions. Even when they may not have the specialty or expertise or are as literate in a certain topic, they still feel as though they are entitled to their opinion and that they are right and other people are wrong. This is when we start to get into the realm of a narcissistic type personality trait and that sort of disorder. People with narcissistic personality disorder have a very unique relationship with others. These individuals are more apt to emphasize the VIP status of their friends or family members, or sort of the wealth of their peers as much as possible. That's sort of what is important to them. If there's an individual who has a friend who owns a Bugatti or some sort of up higher class car, or maybe lives in a mansion, or just, for example, those types of higher monetary value items or materials, that is emphasized a lot more in their relationship with that person. There's less of a per se an emotional connection with that individual in terms of connecting on other topics, such as maybe commonalities. It's more about some of the monetary value and how important that person is in that sort of material realm of things. If they have a friend who has a yacht, you're going to hear about that. You will definitely hear that individual talk about that particular thing, maybe almost every time you hang out with that individual. Some of the personality disorders do exhibit a sort of attention craving trait, somewhat of attention seeking behaviors, and narcissistic personality disorder is definitely one of them. It's specifically that people want to praise their superiority and sort of the fact that they know more or they just are better in almost every other way. How much better they are from the average individual or the average Joe. But here's the thing, and here's the crux of this personality trait, and the really important part to understand. Individuals with narcissistic personality disorder, their attention-seeking behaviors, their covert sort of grandiosity, their sort of above all superior thinking, it all stems from the fact that they are actually really insecure, and there are self-esteem issues and insecurities that they really are not confident about, that they sort of need to either cover up or sort of iron over or reassure themselves that they don't exist or that they aren't that bad in some sort of way that includes either a condescending reaction to other people, whether it's just overtly saying that you're better than other people, it's using the wealth or the VIP status that we were talking about of their fears and the people surrounding them to sort of cover up the fact that there's something in themselves, there's something that they are lacking deeply, that they are very uncomfortable with. And I don't necessarily suggest trying this, but just an example, if you have somebody that you feel like has very narcissistic personality traits or is sort of a little bit more grandiose, a little bit more attention-seeking behavior, and sort of making a bigger deal out of monetary value things. Sort of that sort of maybe quote-unquote big-headedness that you may sometimes find in some individuals. You can try to like think about what they may be insecure about, and maybe even sometimes you can actually point it out. And I wouldn't necessarily target these types of things and maybe target somebody. I think that may not really be fair, and sometimes that can really hurt people's emotions. But if you try to target something like that, they become extremely defensive, and they'll try to either sway the conversation into something else, bring up another individual friend or some sort of other identifying person in their life, try to sway that negativity or that sort of insecurity elsewhere. And they may even be apt to use certain ego defenses, such as passive aggressiveness, which is using some words or some sort of comments that sort of condescend other people around them, or countertransference, which is sort of transferring their own insecurities onto somebody else or upon someone else, trying to make them feel like they're the ones who have an issue with maybe their looks. They're the ones who have an issue with their occupational status, their job status. It's trying to really sway that insecurity in other areas, trying to cover up the fact that they themselves are having that sort of issue. When you're talking to this type of individual, they have a tendency to sort of bring the center of attention back to themselves, sort of trying to bring whatever topic it is, as long as it's not something that's sort of pulling out their insecurities, back to themselves, because they are uncomfortable with not being the center of attention. When they're in the room, you will know it. They sort of have a demanding presence. They sort of really want to have the attention on them because of the thought that they believe that they're physically and literally and figuratively better than everyone else. And it's kind of like they are the show of the conversation, and not necessarily to be the entertainer. It's not necessarily that they're entertaining other people or having good conversations. It's just that they want to be the center of attention and that they should be admired. And they should be admired not necessarily because they have accomplished anything that's over the top, and maybe they have, maybe there is something that there is sort of something to be proud of and sort of to be better than other people about, but sometimes they don't even have those traits, or they necessarily have those qualifications. They may be that they actually don't have a very good job, aren't very successful in any way, but even then they still have the feeling that they're better, and they will either overtly or covertly make you very aware of that. Some of the things we just talked about are some of the proposed diagnostic criteria for saying, yes, this person has this personality disorder, and all it really does is sort of just characterize their relationships with other individuals as well as some of their thought patterns, and maybe talk about why they're getting into certain situations that they do and why they behave the way that they do. In addition, there are some specifiers that can characterize that personality trait even more. And one important example and one very important specifier is manipulation. It's that in social settings, a person is more apt to manipulate other people's vulnerableness and using that crux and that weakness in other people to sort of feed their own ego, to sort of feed their own attention-seeking behavior, and to stay on top, if you will, figuratively, in terms of them thinking that they are better than that other person. They may tend to even have very pervasive negativity towards other people, and this is sort of termed more malignant narcissism, when that individual is using more of those social patterns in order to put other people down and manipulate other people in social settings. Hope you guys like talking and learning about some of these personality types and a lot of just psychology in general as much as I do. Let me know if you guys have any questions or specific comments. And again, touching back on this like I talked about earlier, please don't call anyone crazy. And please know that mental health changes and disorders are very common in our population, and that every person is unique, and they should not be looked down upon just because they may have some sort of symptoms or some sort of traits that may qualify as a mental health disorder.